Hi, good afternoon. My name is Aarti Sharma. I'm one of the registered nurses in Hampton Nursing Home. Today I will be presenting about osteoarthritis and osteoporosis in older adults. These are the common conditions that affects the bones and joints, causing pain, reduced movement and difficulty in daily activities. I will explain their causes, effects and how they impact the quality of life of older adults. Thank you. Next slide, please. Two conditions, one shared goal. Osteoarthritis is the disease of the joints. The joint is the place where two bones meet. At the end of these two bones, there is a tissue called cartilage. This cartilage is thick and smooth. It also protects the bones against rubbing each other. But in osteoarthritis, this cartilage wears away and becomes thin. Due to this, while the movement, these two bones rubs against each other and causing pain and making the movement difficult. So in the osteoporosis is the disease of the um, bones. Our bones, they are a sponge-like structure. These have very small pores inside them, which makes the bones dense and very strong. But in the osteoporosis, these pores becomes very wide, and due to that, the bone lost their density and becomes very fragile. Even a small fall can cause the fracture. We can take example of the new sponge and the old sponge. Old sponge, a new sponge is very firm. The old sponge is very it has a wide holes and can tear very easily. So the, this is the osteoarthritis and osteoporosis. The causes of the osteoarthritis. uh, Aging. Due to the age, our this cartilage becomes very thin, and in that case, the repair is very difficult. So, aging is all that also leads to osteoarthritis. Joint injury, due to sport injury, accident, or fracture can damage the cartilage. In later stage, they may get the osteoarthritis. Repetitive stress. Some jobs are very stressful. They have to bend repeated movements, and carrying extra weight can put the pressure on the knees. Like the cleaner job, they have to bend their knees again and again. The constructor worker, he has to carry extra weight, which can put the pressure on the joints, which also cause the damage to the cartilage and cause osteoarthritis. Obesity. Obesity is one of the causes for the osteoarthritis, because the more pressure was put on the knees or our joints, that cause the osteoarthritis. Genetics. If the mother has osteoarthritis or the grandmother, it's most commonly has the osteoarthritis to that person. Joint abnormality. If someone born with uh, joint abnormal, so due to the uneven pressure on the joints can also lead to osteoarthritis. Muscle weakness, as muscle gives the strength to the bones, but due to a muscle weakness, if the thigh muscle is weak, it can put more pressure on the joint, so that can also cause the osteoarthritis. Other medical condition, rheumatoid arthritis. In rheumatoid arthritis, chronic inflammation can damage the cartilage, and that also leads to osteoarthritis. Diabetes mellitus, due to the diabetes, some if the cartilage is damaged, the repair of the cartilage is very slow. uh, Hemochromatitis, in this condition, the iron is deposited in our knees, that can also damage the cartilage. Osteoarthritis is the main disease which can damage the cartilages. Cartilage is the basic uh, is a cushion in our body. So if it is damaged, the bone started to rub and the person gets pain, stiffness and all. The other is the osteoporosis. In osteoporosis, our bone becomes very fragile. So due to the aging, In a human body, the formation of the bones and the breakdown of the bones is a common life cycle of our bones. But due to the age, it's become very, the formation of the bones is slow and the breakdown of the bones is faster. So that can also lead to osteoporosis. Hormonal changes, like the women who have menopause, the level of the estrogen is low in their body. That also leads to a faster breakdown of the bones. Calcium and vitamin D, they plays a very important role in our body. So if there is a deficiency of the calcium in the blood, they started to take calcium from our bones, and due to that the holes in our bones, they started bigger, and that can also make our bones very weak. Lack of physical activity, as a human being we will walk, we will do some activities, our muscle becomes strength, they get strength. But if there is lack of physical activity, our muscles become very weak, so no strength to our bones as well. Certain medications like long term use of corticosteroids, they can damage our bones as well. Medical condition like chronic kidney disease, in that condition, our body can't make the vitamin D in an active form that can absorb the calcium from our intestines. And as a result, the lack of calcium in our blood, then again they started to take calcium from our bones. Family history, if it is genetic, most probably the person may have osteoporosis. Smoking, alcohol consumption, they can interfere in the absorption of the calcium. So if there is less calcium, then then again they start to take calcium from our bones, and there is the most chances of osteoporosis. Low body weight. In this, there is low mass in our body, no strength in our muscles, no strength in our bones. That can also lead to osteoporosis. As osteoporosis, in the causes main related at the less formation of the bones and the less calcium in our body, that main causes for the osteoporosis. Recognizing the sign and symptoms. Joint pain and stiffness. As in osteoarthritis, there is no cushion, there is cartilage damage. Then while the with the movement, when a person will do any movement, the pain get worsened because the bones started to get rub each other. So it is also when a person after the when he wake when the person gets the rest, or after the sleeping, uh, his body gets stiff, his joints get stiff. It lasts for 30 minutes. After the resting or some moment, it can resolve. Due to the rub, the bones get started to rub against each other. There is a mild inflammation in the joints. They may tender while they get pain while touching that the joints, and while any movement doing the bending or straightening the bone, they may feel crackling or grating sounds. There is also one more symptom, that these fingers, these joints, they may get swollen, and there is enlargement of these bones. Due to the pain, there is the reduced mobility of the person. Difficulty walking or climbing stairs. As the family member or person has osteoarthritis, they may have difficulty in walking, climbing stairs, opening any jar, doing their daily activities, very difficult for that person. So reduce joint flexibility. The person who has osteoarthritis, it is difficult, very painful for them to straighten their leg or bending them. Sitting or standing is very painful for them. Difficulty with daily activities, as they have the pain in their body, they can't do daily activities. As a person who loves to walk a lot, who loves to do their own work, like making their tea, coffee, or going to the toilet, everything is very difficult for them. They are depends on other. Muscle weakness around affected joints. As they have pain, they will do less activity, they will sit down for a long time, which can weaken the muscles. And next is postural changes, loss of height, stoop posture, vertebral compression fractures, chronic back pain. So in osteoporosis, our bones becomes very fragile. Even with the cuffing, bending, the bone started gets the compress. Even the backbone, they started to the vertebra started to compress with the gradually started to compress, and due to that the person lost its height, few centimeters height. And there is a curved bone and the upper side of the back, what and that there is a compression fractures with gradually these vertebra starts to compress, and this is known as a compression fracture. Due to that the person will complain a chronic a back pain, severe back pain. They can complain that they have a pain in their back. So osteoporosis is also known as a silent disease. Until that person hasn't any fall, even from minor fall from a bed, or maybe they will hang a little weight shopping bag, maybe they get the wrist fracture. So it is until this happens, uh, uh, we can't see any symptoms in that person. So it mostly common in hip, wrist, spine fractures, and due to that, there is if the person has a fracture, they may go to the hospital. Then they will come back. They may come with some mobile this Zimmer frame, or they can't walk properly. This can impact on their mobility. I'm sorry, I'm speaking too fast. So impact on daily life. Nobility and independence. Pain and fragility can reduce a resident's ability to walk, dress, and perform personal care, eroding confidence and autonomy over the time. So, due to osteoarthritis, it's common they have a pain when they will walk, or when they will do anything. Their bones are also very weak. So a person, if a lady who loves to do shopping, will go to for the shopping, and due to some reason she has a wrist fracture. Maybe she holds some weight. So she loves to do his own work, doing dress. She loves to do wear the dress, and all the little things she was doing in her daily life. But now she is dependent on others because she needs help of others. It can reduce her confidence, and later stage she is independent on the others. It's a small example. Just like who someone has a hip fracture, they are totally dependent on others. They can't do their own any activity, even for the toilet they are dependent on others. Quality of life and well-being. Chronic pain and fear of falling often lead to social withdrawal, low mood, and reduced participation in meaningful activities. Yeah, pain is very bad in our body. We can The person has a fear. If he has a fall, now he has a fear to walk again. uh, some person are very active in their life. Some loves to do gardening, some loves to do walk, but due to this fall or any pain, they will not they will sit on a chair for a long time. Maybe they have any fear, so they withdraw from they are not doing their social activities which are they are used to. And after that it can impact on their mood. uh, and and the person example loves to do gardening. He was going every Saturday Sunday. He's doing his in the garden he's going, but it helps, it uplifts his mood. But now he's not able to go there. He's in his room all the time. It affects his room. It affects his mood. And and due to this, maybe he started to get upset, very agitated, very angry. So this impacts their quality of life. The care home context. Without proactive support, these conditions as accelerate decline. Person-centered care can preserve dignity, purpose, and connection. Yeah, as a person has a fear to go to the garden, now we can talk with the family member. We can take if he has a difficulty to walk there. We can bring some pots and soils and some seed, we will help him to plant them there. So maybe it uplift his mood. We will talk with him. Maybe we will turn on some her favorite musics. So we will arrange some friends for him that he can talk or he can do chat, which uplift his mood. So next is fall prevention and fall fracture risk. Resident with osteoporosis face a significantly higher fracture risk from even minor falls, while osteoarthritis increases the risk of falls due to pain, stiffness, and reduced mobility. A proactive multi-factor approach is essential. First of all, fall prevention is very essential part. So we make the environment clutter-free. Good lighting, the floor should be dry. There, the in the bathrooms, even in the corridors, there should be this handrails. While walking, they we will provide them walking aid. We make and provide support to them while walking, which increase their confidence. Proper shoe, and we can also encourage them to do exercises which strengthen their muscles. There are a lot of things we can do. Nutrition is also important part of their life. The more fortified foods, calcium, vitamin D. So we will also we will also focus on their pain, because if they want to walk or if they want to do any gardening, before it we will give them their painkillers, and after that the family member will do his work freely without any pain. If we will see, if they are now started to complaining about that, before it he was very active, now he started to complaining about the pain. We don't think that it's a normal thing, but we can escalate that thing to our seniors or our GP, that now he complaining about the joint pain. We can see some inflammation there. Early intervention can prevent further damage. So sports safe mobility and promotion. So assess. We will assess. First of all, we I think we opened the wrong one. So,
Sorry, Archie, have I gone too far?
oh, actually, can I share them? Sorry.
Yes, please do. Sorry.
Oh, it's okay. Okay, just
I might not have your most up-to-date one here. Sorry, Archie.
yeah.
And I also tried to reassure you when you said I'm talking too fast. I tried to unmute myself to say, no, you're doing great. It's really good. And I messed them up then. Sorry.
It's okay. Just
And just while you're doing that, Archie, I love the fact that as well as talking about all the clinical facts, the physiology, the considerations, you're also talking about the social and the individual person in all of this and supporting them. So important.
so so nutrition, exercise, and early intervention. Calcium and vitamin D. As I said earlier, calcium plays a very important role in our body. So for everything, we need a calcium. Even the lactating mother who is doing breastfeeding to their child, they need extra calcium. If they will not take later stage, they definitely get the osteoporosis, because at that time uh, the breast milk also need the calcium. They take uh, calcium from the bones. That lady always have the osteoporosis, their next their life. So calcium and vitamin D essential for bone strength. Encourage dairy, leafy greens and fortified foods. Supplements may be needed. Consult the GP or dietitian. Yeah, for the bone strength, we can give family members extra cheese in their sandwiches, uh, extra creams, cheese. milk, the things that made of the dairy, green leafy vegetables, fortified foods, we can add them in their puddings or whatever they like. Supplements may be needed. Yeah, if we can see that the family member is not taking proper nutrition or they decline, so we can consult the GP. They may prescribe the medications for them, or we can take advice from the dietitian as well. Gentle regular exercise. Weight bearing and resistant exercises maintain bone density. Chair based exercise and hydrotherapy are excellent low impact options. So, to make our body strong, the weight bearing exercises are very important for the older adults as they can't do the regular exercises. Just like we can uh, that's the very easy exercises. Sit down, we will make them comfortable on a chair. We will tell them to lift their leg for 10 seconds and put it down, then lift the other leg, or they can hold the back of the chair and they can lift their toes and down for 3 to 5 seconds, then down. They can also carry a water bottle, not the heavy one. With that they can lift their arm up and down. There are lots of exercises, but before it we need to consult our GP or the physiotherapist because their bones are very fragile, which exercise is beneficial for them. So, and for the hydrotherapy, it is a water-based exercises. It can only be done in the presence of the physiotherapist. So exercise, they play a very important role to make the muscle strength, for the muscle strength and the bone strength. Early intervention, prompt pain management, physiotherapy referral, and medication review can slow progression and prevent avoidable complications. So, if some family member complain about the pain that they have the pain, we need to take immediate action. Uh, just like a family member, he was very active walking all around. Suddenly he complains about that he has a pain while sitting, or he has a his fingers are stiff nowadays. So we need to take it seriously and we need to talk with our GP. He may prescribe some tests for him. Then if it is confirmed that the person is has the osteoarthritis or osteoporosis, then the further treatment will be done by the doctor and we will follow it. And for the physiotherapy refer, they will teach us how which exercises our the person will do. Even the osteoporosis, it is very the bones become very fragile. Even with the coughing, their bones started to compress. So for everything we need to consult our doctors. And the medication review can slow progression. If they started to get the osteoporosis, so timely management of the medication can slow the progression of the disease. Delivering holistic person-centered care. In this in holistic care, we will not only focus on the illness or disease. We will focus on every aspect of the person, like physical, emotional, social, nutritional safety. In a physical, we can focus on pain management. Just when they have when their bones become stiff in the morning, we will apply ibuprofen gel or any painkillers that are prescribed by the GP. It builds a confidence to them. They will start to walk. They will eat by themselves. uh, while walking we will support them with the walking aid and the exercise. And with the help of the exercise their muscles become strengthened. So with this, if we will focus on the physical things, that the family member started to gain in independence and the confidence. So emotional, addressing anxiety, fear of falling, low mood. Emotional, uh, if a family member has a fall and now he started to get fear that he will walk, he may get uh, fall again, or if he will walk, he may have pain again. So we will talk with our family member, we will try to address his concern. And if he has a fear of falling, we will support him with the walking aid, or we will walk with him to reduce his anxiety, and it may help to uplift his mood. Social, maintaining connection, meaningful activities. May our family members started to get upset at he's a bad bone, he can't walk anywhere. So we will arrange to meet with his friends or his family members. We can also go every early to in his room, and we'll talk with him. We'll turn on his favorite music. We'll do activities which he likes, so it will also impact in his mood. Nutritional, calcium, vitamin D, while balanced diet. Uh, a bed bound person needs more calcium, vitamin D, and balanced diet, because his muscles, they are not working now, and they may become very weak. So due to the so we need to focus on timely medications, the fortified food, this dairy products. Not even the bed bound, every family members at the in the elderly age, these nutritional diet is very essential for them. Safety, fall prevention, environment, medication review. Some medications have drowsiness, they can do blood pressure low, they may have impact on their mood. Maybe they will walk and they can walk, they can't they are drowsy, then there is a higher risk of fall. So we need to check which medications can cause these effects, and we will try to prevent the falls. Even with the environment, if environment is clutter free, there are loose rugs, then there is more chances of falls. So for the safety we need to focus on all of this. So key take, putting it into practice. Know the signs. Recognize symptoms of osteoarthritis and osteoporosis early. Do not don't dismiss them as a just old. As we discussed, uh, if if we will recognize the symptoms of osteoarthritis, we will see that uh, the, these bones, the hand bones, there is an enlargement in these bones. The family members started to said that they have stiffness in their hands when they are resting, or now while the walking with the movement, they have more pain. So these are the symptoms of osteoarthritis. Or in the osteoporosis, when we can notice that their height is uh, the shorter as compared to previous days, or they complain the severe back pain, it may lead to osteoporosis. So early detection, and we will escalate these symptoms to our GP. So may they can start the medications, and it can prevent the progression of the disease. Prevent fall proactively. Assess risk, adapt the environment, and use mobility aid consistently. So assess risk. Uh, as prevention is, we will prevent the falls while we will assess their condition. Now that person, the family member, before it he was very active. Now we're walking, he's to one side, he's putting pressure on one side, he has afraid of walking. Due to some medication, he has risk of falls. So when we will try to prevent the falls. So so when we will focus on these things, there may be more chances that we can prevent them. So adapt the environment. If they are wearing the glasses, the glasses should be clear. Always while walking, they can use the mobility aids, Zimmer frame, or their walking stick, or they can use the handrails in the corridors. While standing or sitting, we can support them. This can increase their confidence, and they will walk without any hesitation. Promote nutrition and movement. Encourage calcium rich food, vitamin D, and gentle exercises every day. uh, we can add, we If a person, if we can see elderly person has the issue with walking, or they are diagnosed with osteoporosis, so we need to encourage them to take more calcium rich foods. We can add extra milk cream in their coffee or tea, or we can give them supplements on time. And the exercises, just like walking for 20 or 30 minutes in a day. uh, we can encourage them to go to the garden and walk for a few minutes. Or we can also assess them with the we can also support them with the walking. Sorry. Center the person, not the condition. Deliver care that honors each resident's dignity, preference, and quality of life. As we will not focus on the disease, we will focus on the person, what he wants in their life. So, I'll, a person who loves to do who who loves to do his just like a lady, he went for the shopping, he broke his her wrist. And when she came, and she depends on others while they will do her personal care, everything. Now we will support her. Or she has difficulty put on her trousers. So and now she felt ashamed that she will ask others to do my own work. Then we will encourage her to do your own, just like we encourage her. Would you like to do brush by yourself? Or would you like to do hair comb by yourself? Or will you clean your face by yourself? We will help her where she has pain. But in other the daily activities, we can encourage her to do by herself. Because of she will feel that we are giving her preferences. And she felt the independent. And it will also improve her quality of life. So this topic is this is the last one. So today we discuss about osteoarthritis, osteoporosis, how they impact on their life. Because of this, the pain is very worse. They can't do their own activities. So with the small changes in their life, we can make their life very happy. Thank you so much.